opportunity. The staffing gap is there. So with the staffing norm established by the Ministry of Health, that Excel document, if you add your workload and all that, you will know the number of pharmacists you need. But then there is another opportunity. When it comes to specialist service, like oncology pharmacist, cardiology pharmacy, is opened. It is opened. The opportunity that we have with that is that we need to take advantage of that seriously as pharmacists. Currently, if you look at the Mahama cares on oncology, chronic diseases, prostate cancer, breast cancer, all the cancers, we will need specialist pharmacists in these areas. And this will enhance our salary. And if we appear before them that you want to implement these policies of yours, but we are saying that if you don't have an oncology pharmacist, you cannot set up oncology service in your hospital. That is a strong point for them to start employing. This is one of the things I was using to say. There's a project in the ministry running, that is the childhood cancers. We have the St. Jude Hospital supporting the ministry to roll out childhood services. The drug is free for so many years to come. But then for your site to be accredited to provide that service, you must have oncology pharmacists. When we were determining the number of facilities to enroll, we didn't have much. How many of oncology pharmacists do we have here? Is Roger around? Roger knows the issues very well. And so it means that we need more. We need more. These are the areas where colleagues should just enroll. Ghana College is ready to support us so that we can bridge that gap. We are talking about gaps. We have to be ready that when they call for employment, we say yes, they have to employ. And that one comes with the pathway that leads to enhancement of your salary. If you are a senior specialist, if you get to that stage, you'll be taking salary as the director in the Ministry of Health and Ghana Health Service, in other condition of service. If it is 60 gallons of fuel per month, you will get that even on your salary structure. So why don't you spend your first 10 years and get into that zone? Look at the doctors. That's what they have done. Even if you go to a district, you say this is a consultant, this is a senior specialist. They are making it. All is about enhancement of our salaries. All right, so we need to take charge of that. And there is one thing that we need to work. I want to appeal to chief pharmacists, directors of hospital pharmacies to take up. When financial clearance is given, the wastage for pharmacists is high. People don't take up the clearance. It will shock you that we are asking for 1,691 clearance to employ pharmacists. If it's granted today, by the end of the year, you may only use about 300 of it. The rest is wasted. People are posted, they say they cannot go. Please, colleague pharmacists, for us to bridge the gap, if we have been using all the financial clearance, the number will not be today 1,060 pharmacists in the public sector. It will be more than that. So let's take advantage, chief pharmacists of the Ghana Health Service. When the young ones have issue, we try to find out why. It's the insecurity of accommodation. Where to be for the first 6 months while their salary comes. They can rent their own accommodation, but the newly posted, you don't even know the terrain. So please, the chief pharmacists, we are appealing to you, help us. Lobby for them in those hospitals. Visit them and tell the medical student that even if you cannot provide free for 3 or 1 year, as much as possible, then rent as a loan for them, so that they can have a place secure and safe and start working. If their salary delays, please give them an advance payment. With that, they will stay. And then the advantage of working in the rural area is so great. Those who we have posted into the regions, when I joined the service, some are now going to become consultants. I am still at the senior specialist because I was working at the headquarters. I don't have that privilege of working for 3 years to get my promotion. I have to work the full 5 years in Accra at the headquarters before I get my promotion. But those that are posted, they are looking to my face. They are now they are taking higher salary than me because of working in the rural areas. Working in the rural areas is not an disadvantage. You get the profit of it in the next 4 or 5 years. So, colleague chief pharmacist, please help us in this area. Other every day we'll be discussing the gap.
Okay. Thank you very much. So it's a stepping stone when you are posted to the districts. Please take up the challenge and go. At least you have a plan in focus. You'll be able to get there and not complain about remunerations again. Okay, please, do we have any questions? The time comes, please.
Thank you very much. Mine is an addition to what the Director of Pharmaceutical Services from the Ghana Health Service said. It's about data. Now, the thing is, before you ask somebody to get data, you should teach him or her how to make use of it. In other words, how to analyze it. If they don't know how to analyze the data, they'll be reluctant in even getting it together. Now, in this day and age, all teaching hospitals, all regional hospitals, all teaching hospitals have been networked using one particular database, which means we have loads of data. But I wonder how many pharmacists in the Ghana Health Service or teaching hospitals know how to do advanced Excel. That's the thing. So we need to get them involved in the area of data analysis, so they will appreciate the need to collect data. Then you will see the change. Thank you very much.
Thank you very much. Any other questions? Please, if you can raise your hand. All right, I see 3 hands. We'll take the 3, and then we'll get the answers, and then move on.
Thank you very much. I think mine is just an addition to my brother, Mr. Yebuche, and then the director. You see, the current government has prioritized where it wants its money to go. Within the policies of the government is prioritizing the primary health care concept. It was a manifesto promise, and the government have decided that that is where they want to focus. Our concern is how pharmacists understand the primary health care concept and our readiness to take advantage of what it comes with, so that all the remuneration and the recognition that we want can be realized in a short time. The primary health care concept was initiated by Alma Ata in 1978 by WHO and UNICEF. What it seeks to do is to bring healthcare to the remote areas, communities, broaden access, make it easier, have the most qualified personnel to be there to manage. Pharmacists would have to position ourselves to set up areas in CHIPS compounds. Are we ready to go there? We must have our presence there. We must set up pharmacy desks, pharmacovigilance desks, and then integrate ourselves to primary health care or public health concepts at that level. Make sure that we have our teams in the public health teams within the regions, because they are the people that are directly involved in the primary health care concept. And the focus of the government is there with its money and budget. The director just mentioned that a lot of areas you go there and the pharmacists are not there. We all want to be in the cities. If we don't strategize and sit down, understand the government's concept, and push our colleagues, especially the young ones, and ensure that specialists, like the director said, you go to Pram Pram, you go to Afram Plains, the medical doctors there, they are all specialists. Luckily enough, I'm humbled to be in the same committee with Honorable former Minister, Honorable Joseph Ilechre. When this manifesto of allowing pharmacists to be able to do certain things under the primary health care was enacted and was proposed and discussed, myself and him were in the committee. We were the only two people who said yes, pharmacists deserve to be in those positions, because the government is saying that for the primary health concept to be successful, pharmacists must be made partners. They must be allowed to diagnose certain diseases, do certain prescriptions, treat and report accordingly. Some of our colleagues, I don't want to mention, said no. And some of them even said pharmacists were only trained to sell drugs. I got up and I, nicely opposed it. And then he supported me. But what is happening is that is the perception out there. Under this concept, in the primary healthcare system and the communities, do we have laid down reporting and referral systems where a pharmacist can, first do some, checkups, BP, others, SpO2, document it, and then if it is beyond the pharmacist's, capability, you nicely write a referral documenting all this to a tertiary facility so that care will become seamless. Currently, there's a gap in that region. It's missing. So our other colleagues are saying that the pharmacists are the ones creating the problem for us. If you want to fit in the primary health care concept, which we must take serious, then we have to look at these things. Thank you very much.
Thank you very much.
With your permission, please, if you take the SOP 2018, it spells out all our job descriptions from pharmacists to specialists. Now we are training more people. Madams encourage people to go to school to improve their studies. But when they come back to the hospitals, the same desk, the same furniture, the same small room. So when they are developing new facilities, I don't know whether they call you to bring your input, the architecture. So they come back and they are doing MCA work. They doing MCA work because there's a small desk for dispensing. So I don't know, you have to put this one into consideration.
Thank you. I'm Farm Daniel Kwisikwa, Director of Pharmacy, Upper West Regional Hospital. I've been in the North for the past 20 years. So if I'm talking, I know what I'm saying. All my leaders there have talked about. Dr. Ivuche said the directors should ensure that they create the enabling environment for these pharmacists. I can tell you for the past 20 years, how many Upper West are here? Oh, you can get up. Those who work there for the past 20 years. Don't say you're a specialist. From Salon Oncology Pharmacist. So I said after here we are coming to you, to your place. You could see that these are people who they struggled to stay. There was no support from anywhere. You don't get support from all the directors we met throughout. They have to struggle to be able to stay in these areas. But as a doctor who is just coming out fresh, the accommodation is ready, well furnished, everything. And they give you details of allowances they are going to give to you. And that even attracts them to come and do locum first, because I acted as a medical soup for 5 good years. So I know what goes into it. And they will do all these things, and even sometimes letters come from the region stating exactly how they should treat these doctors. But I've sat at Upper West for 20 good years. Such letter has never come. And I know this is what, talking to other pharmacists in the various regions, this is what goes on. How can we really attract these pharmacists to come? And two, you talk about going to the rural areas, your promotion is faster. Now it is not so. I know Chief Director of Pharmaceutical Services will tell you. They have brought another caveat that there are some areas in the region, those are the one considered what? Rural. So you will spend, if it is for 4 years, you spend 3 years before you will be what? Promoted. But if you find yourself in certain towns within the regions, you go for the same 5 years with others in the cities. So this is what we are seeing on the what? On the field. So I think all our regional chief pharmacists should support Dr. Ochil, because I've worked with him and I know what he's doing. They should support him and put in certain measures that will really attract. About 18 pharmacists were given clearance about 2 years to come to Upper East through the effort of the regional chief pharmacist, Dinah. Only 3 reported. They just came, look at the place, and they left. Why did they come there and leave? And they were even to put at what? Bulgar town to work. What necessitated them